Okay, this video is going to talk about the TENS unit. And the TENS unit, like we talked about, TENS is used to reduce muscle spasms and release some endorphins, some natural painkillers. You have a pinched nerve, okay? The sciatic nerve is getting pinched. It's causing the muscles to go into spasm. We want to reduce those spasms of those muscles, take pressure off, reduce the inflammation. And so we're going to put it at the point of issue, which is in your lower back. We're not going to put the stim on your leg. We're going to put it right in the lower back. And that's what talks about the next portion of this video is where to put the pads, okay? So once you start feeling better, you're going to use less and less of the TENS unit. TENS should only be used when you have spasms and symptoms. You don't want to be doing it as a wellness model. Some people go to chiropractors or physical therapists or wherever, and they put them on TENS every time. So it should be only used when you have muscle spasms and irritation. You can use a TENS unit for anything, for shoulder pain, okay? Tennis elbow. We have other videos about tennis elbow. Sciatica. I mean, it's a great device that you'll use, and it will last usually for a very long time. So watch the next video. Like I said, as you start to feel better, use less and less of the TENS. And make sure you watch the instructions so you know pad placement. It's very important to know where to put those pads, all right? Watch the next video. We'll see you soon. Okay, when you get your TENS unit, what you want to do is this is the TENS 3000, you want to open it up, open up the case, and you'll see inside a few different things. There's a manual, which is always good to read, so read the manual. I'm going to give you the settings that we use for treating sciatica. Also in here is your electrodes. There's going to be 4 electrodes in there. Okay. There's the unit itself. This is the TENS unit, and we'll talk about the battery to put in here. And then here's the electrodes. Very simple to use. And we're going to show you how to kind of set this up. But it's good to read the manual. I'm going to give you my settings that I'd like you to set it at that seem to work best for sciatica. So don't necessarily follow the manual for the treatment that we're going to do today, but it's always good to read that manual and go through any precautions. Remember, there is obviously some contraindications for using the TENS unit. One is a pacemaker. You do not want to use a TENS unit if you have a pacemaker, okay? Because it can alter that. Also, if you're pregnant, you can't use it around the area of pregnancy. So obviously you can use it on the spine or the leg, but you don't want to be using a TENS unit around the area of pregnancy. So anyways, I'm going to go into the next portion of this video of the settings, how to set it up. It's very simple to use. Make sure you follow the instructions. For me, for sciatica, I only have patients use this for 15 minutes at a time. Okay, so watch the next portion here. Okay, so what we have here is, this is the TENS unit. This is the battery that's included. And your battery may look a little bit different. This is the color. This is the cover, okay? So when you get your TENS unit, there's probably going to be a cover on top of it, all right? Just open the cover by pulling this down, okay? And take this off, because you want to put the battery in. So you'll undo there's sometimes there's plastic over this. Just make sure that the positive goes in the right area. This is the positive in the battery, and that wants to go in this top portion here. So make sure this sleeve is underneath, so when you need to put the new battery, you just pull this up. Okay, so we put the battery in here. We push that in. Okay, and then for mode, the correct mode is actually N. So right in the middle. And then your pulse rate, we want that at 70. So once again, pulse width, 150. Your mode, the control right there, we want that at the middle portion at N. And your pulse rate at 70 there, okay? So that's for sciatica. What you want to do is it also includes 2 electrodes. I'll zoom this out so we can kind of see those as well. So these electrodes here, it includes really 2 of them. So there's, at the top, you open up this case here, and then you'll see these 2 holes on each side. You want to plug in one of the electrodes here, and the other electrode over here, okay? And they just slide right in there really easy. The other thing that you're going to see here is also the intensity of the stimulator. And so the intensity here, when you want to turn this on, you're going to hear a click here, turn that on, and then here, and it goes 1 through 8, all right? I usually have patients between, I don't know, a 2 and a 4 for intensity. You do not want to go up to about, especially with a fresh battery, up to about a 6 or above, all right? For right now, I'd keep it in between a 2 to 4, 4 being the highest, especially with a fresh battery. As the battery dies down, the intensity is going to come down, so you can increase it. All right, so averaging about a 3 to 3.5 here for intensity. Okay, so that's how you turn it on. All right, so these are the electrodes down here, and what you want to do, and I'll show you in the next video, is where to put the pads on your back or have someone help you, is you want to put the pads on the back first, and then you want to, afterwards, once the pads are in place, then you're going to hook up these electrodes. Remember, red is always going to be where the electricity is going in. That's where you're going to feel the actual TENS unit. All right, black is just ground. So you're going to feel it around the red area, all right? So watch that next video. If you have any questions, you can always email me. Make sure you read the manual. Obviously, the case should be set over here. Do not leave this around any animals, young children, okay? So make sure it's in a safe place after you're done using it, all right? And we'll see you in the next video. So just remember when you're using the unit, to make sure that when you're starting, when you turn it on, let's say you have the pads on your back, everything's connected, now you want to turn it on. Remember, when you turn it on, you want to turn on both sides and turn it on very slowly. You don't want to just crank it up because it will make you jump. It causes muscle contraction. It's trying to fatigue muscles that are in spasms, so by almost contracting them, it makes them relax. So make sure when you turn this on very slowly. This pad here, so we're going to have a red, we're going to have a red, and then we're going to have a black and a black like that. Okay, so sciatica, left side sciatica, we're going to have 2 red, 2 black at the top, all right? And if they start to feel it higher up in here, sometimes it will spread, then you got to move these pads down lower, okay? So make sure you have, this would be a setup for sciatica here with 2 lower reds if she had left side sciatica on this side.